If someone is too short, abnormally short, that's what we could call stunted. We didn't know that even stunted even affects the brain. So people were saying, no, it can't be true. In Itojo, we can't be stunted. We can't have that problem. We have enough food. We have everything.
Malnutrition is one of the things that maybe is leading us behind, not as only the district but as the country. They call us a food basket, and it's true. So those are, I believe that is the major focus, and we are not wrong. Yes, that is what we need to do, to focus on the nutrition status improving right from the start.
This video captures the intervention of the Spring Community Nutrition Project implemented in southwestern Uganda.
With the help of the Spring officials, whom we have been working with on several trainings, meetings, sensitizations, people came to really realize that it was true that problem or this problem was there. It has been with us.
When they came, they helped us to strengthen the district nutrition committee by involving all the partners. As the project started strengthening partnerships, at the district, nutrition was looked at as a health program. After that, we were able to be oriented on the nutrition issues based on the National Action Plan for Nutrition Action Plan.
That's when we talk about a healthy body. We cannot have a healthy mind unless we have got a healthy body. Our people through sensitization have come to learn that proper feeding in the right quantities and qualitative food is very, very important, even before we talk about immunization, before we talk about medication, before we talk about any other program.
The area of interest was strengthen the household key behaviors, especially looking at the life of a mother within the first 1,000 days. That is when she is pregnant and she delivers, and then the child after looking at the child after 2 years.
The first component was related to promoting key behaviors using a community-led video. So communities were really involved in the development and the production of the video. And this video was used by the village health team members, which is part of the Uganda Ministry of Health policy, to facilitate and trigger dialogue at the community level with community groups we called Great Mothers, Wise Women, and Fabulous Fathers.
So basically that's how the video rolled out, using the local people, giving testimonies within the same people, and they get to learn from one another. So we had to use the local people because they easily identify amongst themselves, they easily relate, they easily communicate, and they are confident and not shy to go and inquire much from them.
So 4 main key behaviors were targeted during those discussions. The first behavior was about promoting exclusive breastfeeding. The second behavior was related to feeding a sick child. The third one was related to caring about a recovering child. And the last one related to seeking medical care or medical attention for a sick child.
Specifically, me as a person who has been coordinating the VHTs, I think the VHTs have really gained more than any other person, because they have been able to get a deep understanding on what nutrition means to the communities, and getting the information to the communities, because their basic training does not actually go deeper into nutrition issues.
Amazina ye Edirisa Mbangizi Rukuruga Charhuga Parishi Bwongera Ntungamo district kandi ninye VHT wa Charhuga yo kubanza ahabwe okugona kw'abana n'abakazi obutahamushaga amabenda.
Out of the story they are trying to tell the audience, they're trying to throw in a few points that are linked to nutrition, but also to help them make the audience relax, feel free to share anything that they want to share.
Hati ibitwa bintu egisa batata babo muhendo nibikushana n'ibitwa bintu egisa ba mama bo mutana abo kuba tukantumanya ngo batata bo muhendo babakwatanise na ba mama bo mutano ibitwa abantu begisa nibyongera kuteka mu nkora.
Kugira okunatangira ukonsa umwana wanje okubanza nkaba ntine mashereka mu kifuba toka kunatangira ukonsa kunagiye umwana wa kabiri nkegisebwa ukonsa umwana wanje nayonsebye tandika n'ekiro cyo kubanza nayeza kumuzara okumwosa k'umwana kampeza amashereka amarungi nayonsebye umwana wanje amezi mukaga gukubanza ntine sinamuhire kandi namunza emirundi nyingi buri zuba.
Umuntu ndike yakiza amezi mukaga naura namanta amezi go kumunsi hati ata unshimiye kutandikira kumuhereza icyo kurya.
We've tried to build capacity for VHTs in preparation of complementary foods. We always call it chitobelo in our local language. It is a mixture of several foods, a food from each food category, and for the bodybuilding foods we encourage the mixture of both plant sources and animal sources.
Nkampereze mondi na tabaramuna n'ebinyobwa abo kuba nariba ngo n'ebyorobi ebishima kuba ntantisa umwana kunkwijuka je ibyo natandikise kuna herize nayongeraho naguma nimpereza n'ebijuma namuhereza vakedo namana greens za dodo natandika guma kumhereze ebyo kuri byo kumombe ko mbiri ebyo kumukoraje. Umwana wanje ati ndeba akizo mwaka gumwe nindeba atine nshonga ayina amagara marungi.
Nushanga kugira ngo umwana akeneye kuba najyaji kwirinda ukubasa kubona akakura ayina amagara marungi kandi ikindi yakwasa ububwire kamwirukaniza umubeshaho akabasa kumaragura.
People had started to turn up for health services. Instead of treating them at their home areas, they came for health services at the health centers.
Shemerire kukunda abana banje nabashasha nkashasha nabo kandi ubuzima nanye kagira ko nabagerera n'ibiroto birungi tutari kubakena ninga kuza kubanga muri kubateje biroto bishikira.
In regard to a sick child and recovering child, we've always emphasized the need for extras in everything they do. An extra meal, an extra amount, extra frequency, extra patience and love.
The second component of the intervention was about providing support to various nutrition coordinating committees at the district and at the sub-county level in order to ensure them to organize, plan, coordinate, and oversee all the nutrition activities in their respective areas. The third component was about tying all the above together to ensure that we have a community-generated response, collective response to addressing malnutrition and stunting in their respective areas. So the project facilitated a participatory and engaging process with the communities to ensure that they really take part and act collectively to bring their own solutions using their own resources at the community level. And we use an approach better known as the community action cycle to achieve that.
After training them, they started on projects like backyard gardens. Then they planted greens, fruits, others were rearing poultry, all of which were focusing on fighting malnutrition and anemia.
Omu bintu ebitwayegesiibwe aba spring nkaba memba ba CAGS bakatwegesamu ebintu nka bibiri nga bishatu kega kikwatiine twaturi ahansi ya action plan kandi twamperonderamu tusharamu ekituragende nakyo omuseero ziitu twareke tubegese n'ebyokurya ebashemye kuba nibahinga ebikureberera abaana babo.
And so, because people owned what they discussed, these action plans are being implemented by communities in direct supervision by the VHTs.
When it is time for mobilization, they would do it with passion. You'd see that they have a heart to have a child saved from stunting and anemia. There is an increased number of, when you're interviewing mothers who were able to give birth during the time Spring Project has been on, exclusive breastfeeding for the first 6 months, it has improved compared to the past where mixed feeding was more common.
In the assessment we carried out, rat coverage had improved, and hand washing practice had also improved. And actually, when you visit these health facilities that we have, you can look at the trend, and the cases of admissions at health facilities have actually gone down.
For us, we said that now that spring had gone, we shall maintain the what it was doing, we shall cope from it, and we continue. That's what I can say.
Chona kugasobanukirwa bw'imizire bikagushyikiriza kugira ngo unishe nimureba n'ikindi
bwanyuma yabataka kutunga kwegesa ibikorwa yitwe barimo nibareberera abana babo, abana nibateka kureba baje tubagasogura.
Muchetimba mahanga